family. It's been a while, but we are back. We have missed y'all. February is Black History Month and it's Heart Health Month. What a better way to honor both Black History Month and Heart Health Month than to bring in one of the dopest Black females that we know. And icing on the cake, this beauty is a Maharian sister. Woo, y'all. Can y'all tell how excited I am to introduce Dr. Latasha Lewis, a pediatric cardiac intensivist with over 15 years of expertise in this space. Dr. Lewis, Tasha. Hey, girl.
Hey, girl.
Thank you so much for joining us for this very important topic that is near and dear to our hearts, congenital heart disease, one of the most common types of birth defects. So, Tasha, tell us about your career path. What made you choose to be a cardiac intensivist?
Cardiac ICU chose me. When I first entered med school, I was going to be a cancer doctor. I just knew that I was going to save all the kids with cancer, and the St. Jude commercials broke my heart. And so I knew I was going into cancer and cancer research. But then, because you know me, I'm a busybody and I like the ICU. And then once you start taking care of that vulnerable population of heart kids, it pulls on your heartstring. And so I knew after I was introduced to the heart patients, that's where my career path would go. And so everything kind of shifted from going into HEMONC to deal with, cancer patients to doing ICU and then to go back and take care of heart patients.
Awesome. This is going to be a really good conversation because when we think about the heart and all that goes with it, we think about high blood pressure, high cholesterol, we think about heart attacks, strokes, diabetes, and everything in between. But today, we're going to talk specifically about the kiddos. What is congenital heart defect disease, and why should there be a specific awareness around this particular disease?
And I'm glad that you brought up your introduction, because most of our community, when they think of heart disease, they think about the things that you mentioned: hypertension, high blood pressure. They think about cholesterol, and they think about their grandparents. Oh, my grandmother had heart disease. But when you think about heart disease that affect kids, when we talk about congenital heart disease, we talk about heart defects. That is something structurally wrong with the heart, and these kids come out the womb and are born this way. And so a lot of us, we've heard people say, I had a hole in my heart, it closed. Oh, my cousin had a hole in the heart, it closed. When people mention that, that is a form of congenital heart disease. Congenital heart disease is the #1 birth defect in the world. It's just most cancer, pediatric cancer gets more publicity, but there are more kids affected with congenital heart disease than any other birth defect in the world. It's just that it can consist of multiple defects. So one person may have one lesion and somebody else may have a completely different lesion. So that's why it doesn't get all the traction and the publicity as other congenital abnormalities pediatric patients have.
Tasha, quick question. Are these defects typically detected at birth, or are there kids that walk around with, the defects and they don't know? Like, how commonly do you find them at like birth or pre-birth?
With the screening that we do for when you do your genetic screening when you're pregnant, that is usually where we hope to pick up congenital heart disease, but that is not always going to pick it up. And so what we have is, for lesions that have the mixing of the blood, and so your oxygen level is not the same as people without those mixing lesions, before you leave, they'll always test your baby's oxygen level to see what it is. And that's one of the ways to try to catch the most critical congenital heart disease before you leave the hospital. But even with that, we still have some of the kids with a serious congenital heart disease that are discharged home, and they don't know until maybe they present with signs of not eating well, not gaining weight, tired when they're feeding, and parents bring the pediatrician and they hear a murmur. But we try to, with the prenatal screening, the pulse ox check before you go home, we try to see if we can catch majority of congenital heart diseases. And most states now have a law that when before a baby is going home, that they check their oxygen level just to see if they, after a certain level, it now needs more testing. And so that's a way that we try to catch you before you go home.
So you mentioned in your prenatal screening, is there a specific test that an expectant mom should be aware of having done or not having done during that time frame? If they have a propensity or an idea or a family history of heart disease or defects?
So there is a genetic component, but that's only 15% of the cases. We do know that smoking and hypoxia can maybe increase your risk of having a congenital heart disease. Other birth defects like Down syndrome, Noonan's, Williams syndrome, and we know that like DeGeorge, other genetic disorders can be associated with it, but really just going to be your prenatal screening to see if they see the heart is not together right, like something is not right, and then they'll send you to further testing.
You're referencing the anatomy scan. Is that what I'm hearing on the
Yes.
screening, the anatomy scan of the fetus, correct?
Yes.
Okay.
And if you do the genetic testing, like I said, some of the genetic testing is associated with heart disease. So like if your genetic screen comes back and you're positive for trisomy 21, that is associated for heart disease. So they might look at the anatomy screen a little bit more careful than what they normally would have done, and other genetic things. But a lot of parents, people do not do the genetic screening and the anatomy scan. If you don't do prenatal care, then that may be missed as well. So that's why it's good that the hospitals have implemented the pulse ox check, where they check your oxygen saturation before you leave. And it's always, a good physical exam by the pediatrician that assessed the baby in the hospital to also to look at heart murmurs.
So once a congenital heart defect is detected, are there treatment options, or does it depend on the specific defect?
It depends on the specific defect. So about 1 in 4 of the congenital heart disease are going to be critical congenital heart disease, are going to need some intervention in the first couple of days of life. And so that's why a lot of people don't know about congenital heart disease, because there's so many different variations of the heart. So when we think about it, how the heart can be put together, if one piece of one like valve is missing, that's one associated. One chamber is missing, that's another diagnosis. If this is just small but not super small, that's another diagnosis. So it is multiple diagnoses that comprises congenital heart disease. So depending on what your diagnosis is, depends on what path that you'll go as far as treatment.
And are there communities that experience CHD more than others?
We do see that there's multiple studies have shown that the Black community and Hispanics are more likely to have congenital heart disease. They're still trying to figure out, is it a genetic component? We know that the diabetes, obesity, some of that can be a factor, but other factors that we're still trying to do research to see why, because we do have a higher incidence and we do have a higher mortality rate for the same diseases.
Can we get into this prenatal care a little bit, and lack thereof, and the communities that are most impacted or least educated around what steps they should take to have proper prenatal care, and how that impacts the babies and the children ultimately?
So like the prenatal care, the most important part is going to be making sure you follow with your doctor, because when the genetic, if there's a genetic defect, that happens at conception. And so if they'll sometimes offer that to older mothers, but sometimes insurance companies don't pay for that. So even with the lack of prenatal care, if your insurance company doesn't pay for all this extensive testing, then a lot of people opt out of it. And then prenatal care, and then is the anatomy scan. For most people, they just want to know if it's a girl or boy. And so there's just a gender reveal. Do I have a girl or boy? But in our world, we want to know girl, boy, yes, but are all the the chambers there? Is everything where it's supposed to be? Is it coming out of the right side of the heart? Is it a blockage? Because the heart has, just like plumbing, which way is it going to be rerouted? And the body is smart, and while you in the mom, you're going to be okay. It just once you're separated, how are we going to take care of this child? So the prenatal scan is going to be the most part, but like the genetics is going to happen at conception. So if there's a genetic,
Tasha,
You know,
I think it's a lot of fear, like in my mind, I'm like, I'm gonna go for every single visit because I want to know. I want to stay on top of these things. But, we know this group has a certain level of education and respect for medicine and understanding of how knowing things earlier can actually help. Um, could you maybe touch on like just to encourage our viewers around like the importance of like having information versus having the attitude of I just don't want to know. You know what I mean? Like if there's something wrong, I just don't want to know. I'll find out, on the back end versus like, being proactive and really going to those visits and having the information so that if something is wrong, your care team is prepared to handle those things when the baby is born.
absolutely, because knowing is always better, even just mentally for the family. And we've had some families, like I mentioned, that are not diagnosed. The prenatal anatomy scan missed the diagnosis, and so finding out in the hospital has completely changed the trajectory of what the family had for themselves and for their child. And so when then your care team can be prepared, because there's a small number of kids with congenital heart disease that we need to know that your child has that defect, so we can be prepared at delivery. So there are some that, based on what condition your child have, that you are brought into the hospital, you are delivered in the pediatric hospital, and either in the OR or close to the OR, or either we need to take your baby directly to the operating room or to the cath lab for a procedure. And at that time is very precious. And so the minutes means life. And so we want that baby separated, and we want that baby in our care as fast as we can so we can intervene. And so if we don't know about that, those babies are likely not to survive. And then also just planning for you. So just knowing that, hey, if I have a child that has congenital heart disease, what does that look like? It's about educating yourself, talking to other family members of, hey, my child has this, to find out if there's any family history that you may not have asked about before that. And also talking to other parents of kids who have congenital heart disease, because the community, the congenital heart community is one of your biggest resources. And just to be able to talk to other families who have child has had that disease, the problems that they face, things that they found out that helped, doctors that they recommend, hospitals they recommend. And so just being able to prepare yourself is always better than finding out in the hospital, you're happy that you got a new baby, and then they're whisking your baby away because something is wrong and that was not expected.
Just to jump in here for a second, and I know, again, I said in the beginning that this was very important and a personal story for BSC group, particularly me, being that, my son was born with a congenital heart defect. And, just to your point, I went to my 5-month checkup to find out if I was having a boy or girl. And, just that long pause, that wait, the I'll be right back came as a result of that. And that's when I initially found out that, I would be placed into this community of support and trying to find out more information about my son and this defect. And, it's very scary moment because, once you're giving that news, it takes away the joy of being pregnant because you're on pins and needles of what to happen for the next remaining of the months. I mean, and as Tasha said, we were having the birthing plan. We lived 45 minutes from the hospital, but we had to have a plan in place. Like the minute you even think you feel something, you need to be heading that way. So it's twofold. It's that part of, as a mom who's carrying a child that has a congenital heart defect, is that piece of, switching your focus of the joy of being pregnant to like what is like you in plan mode. You're like, okay, this is who needs to take the kids because we have to go. It changes your whole birthing plan. And, it takes away the joys of, and personally for me, it was, y'all, let's not do the baby shower this go around, and if y'all could remember that was something that I had to be talked into because, it was that fear of the unknown when you're giving, a diagnosis like that. So it's a very, very challenging space to be in, and it's important to have a community around you for that support of that, and know that every day it's going to have its own set of challenges. But in my case, thankful that my son is here. But I thought this was an important topic, and I'm just so thankful that Tasha, that you came on to talk about this. Tasha and I actually came back together because of this very topic. We, of course, Maharian, we saw each other at school, but it was this particular topic that brought us back together when Carter was very sick, and she was my remote cardiac intensivist, kind of chat, getting us through some very tough times. So just wanted to share that, and excited to be talking about this, and encouraging everyone that when you go for that 5-month checkup, that, not only are you need to be excited that you're having a boy or girl, but also that heart is pumping the way that it should.
And Shantae, do you want to share with the audience a little bit about Mr. Carter and his journey, and because you were proactive and because you made the decision to go to your appointments and to know and to plan, share a bit about Carter. How old is Carter now?
Carter is now 6 years old. And again, at 5 months is when I found out that he had this defect, and it was week by week kind of touch point for him. And for us to see 6 years old is just beyond amazing. He's just a regular little boy now, and we get to appreciate this parts of him being a boy. In those moments when I do complain that he's being too much of a boy, Tasha definitely wheels me back in. And lets me know to be thankful for that he is, cutting up in school. So he is thriving and doing very well. We are very blessed, but we use the resources that we have, and we use the groups that were available to us to bring some awareness to what it was that we had. And then I had a great support system to kind of get me through those rough moments, hospital nights, surgeries, because it takes a toll on everyone, and I'm blessed. We are blessed to have Carter in our life. We're blessed that he has brought so many wonderful people and resources to us.
I'm glad you brought that up, because the resources and the impact, because when some of these congenital heart defects, when you have this congenital heart, we say disease, this is going to be a lifelong, journey for the families and the patients. And in the beginning, the kids with the critical congenital heart disease, when we look at hospital stays, some of these kids some of them are born early, they're born small, they have to have surgery in the first week of life, some in the first 2 to 3 days of life. And then from there, you're in the hospital, you're dealing with coming to the hospital, seeing your baby now with a scar going down their chest. And for the families, that is just overwhelming, even when you know about it. And just to see your baby, you hear about it and you talk to families, but just walking into the room and seeing your child after surgery, you'll never be prepared for it. And we try to do our best to prepare them and talk to them and tell them what they're going to see, but it's not going to become real until you see it and it's your child. And from there, you have getting out there, the breathing machine, getting off the medications, getting off oxygen, and then learning to feed. So, we just take for granted, soon after delivery, they want to give you the baby and put the baby to the breast or give the baby a bottle. But for congenital heart disease, trying to get kids to feed, a lot of our kids end up having feeding tubes, and the hospital stay is sometimes months. And so you have kids that are not going home until they're 3 or 4 months of life. Some are even longer than that. And so then you're talking about the toll on the family of having to go back to work, dealing with the resources of having a child in the hospital, trying to be in the hospital with this child, and you have other children trying to be at home with spending time with your other children, and just be always having someone there. So that's why it's very important, because I think sometimes people don't understand when you say my child is in the hospital and he has heart disease, what that means to the family. And sometimes it's just, hey, let me come to the hospital and sit with you. Let me just, buy your family a meal and just pray for you. That alone goes a long way, because it does take a lot, and mentally, spiritually, it just takes a toll on the family. And so we really need, when we say we are a village, for congenital heart disease, we need that village to surround our families and support them during this time, because it's a hard time. Trying to decide, do I go to work today, or do I stay in the hospital because today they're going to pull the breathing tube out? And some parents don't even have the option to make a choice. Is either go to work or lose your job.
So Tasha, can you tell us, and kind of introduce some of the things that has been that we've set in place to try to counter some of these things that you just mentioned?
Yeah, so
should I do a drum roll or okay?
So, just, with, Shantae's story and things that I see in the hospital, and that's in just different states, different hospitals, same thing. We have families, especially the minority families, in the hospital, and sometimes we don't have the same available resources, or sometimes the resources are available, they're just not offered. And so what we decided to do is come up with a society. It's Melanin Congenital Heart Society. And what our goal is to advocate, and we want to advocate for our patients and to speak up for our families. Like when Shantae mentioned that when Carter was in the hospital, she had me to talk to. And so we'll talk about everything before she met with the doctor, so we can tell her, okay, let me ask about this, what medications you on. And a lot of people don't know, anybody in medicine are not part of the blogs, do not know about the network of other heart moms. So it's about to advocate for the patients and give the family those type of resources, and also to educate the community. And that's one of the things that Melanin Congenital Heart Society wants to do, is educate the Black community that this is real. Congenital heart disease is real. It's more common than what you think, and it affects us more, and we have the worst outcomes. So what can we do to decrease the disparities and support our families at the same time? And so we have, last year for Heart Week, we went to the hospital, and in New Orleans, we provided lunch for the healthcare workers. At Laura, we provided them some cookies. We provided something for the healthcare workers. And when I was there, I gave a talk about the Melanin Congenital Heart Society there, and just to bring awareness about what it's like to be a minority in the healthcare field, and not in the healthcare field and in the congenital heart disease world, because we have disparities when you talk about, the OBGYN and then the mothers, but no one is talking about the disparities that we see when it comes to congenital heart disease, the same defect, but yet we are more likely to have a worse outcome than our Caucasian counterparts.
Well, this is phenomenal. This is phenomenal. And, it's just a real testament, in my opinion, of when God blesses you with knowledge, and care and empathy in your heart, and you extend it. Shantae and I were just talking about spiritual gifts. Okay, let's go there. Spiritual gifts and how each of us are blessed with a certain set of gifts and talents, and how we use these things to help uplift our communities, and to try and circumvent some of the disparities and the gaps that we're seeing out here right now in healthcare. And so, Tasha, I just want to thank you for coming on the show. I want to also thank you just for everything that you do and all that you give from yourself to help children in general, but especially our little Black kids and families. I wish you and Shantae all the best with the Melanin Congenital Heart Society. I think that is going to be amazing, and I can't wait to hear more about it. You are welcome to come back as the society continues to grow. Anything that BSC can do to support, please do let us know. Any parting words for our audience? Anything you want to share before we take it on out of here?
My parting words would be, if you're a new mother, if you're pregnant, make sure you are eating healthy, making sure you're taking care of yourself, make sure you go to your appointments, and most importantly, do not miss your anatomy scan. Even if after the anatomy scan, something's not right, follow your gut. Always follow your gut, because you know more. And if you're not getting the answers from one person, always ask for a second opinion. And then, reach out to resources. There are a lot of resources online. We will have Melanin Congenital Heart Society. Be informed. So when you're in the hospital room, when you're talking to the physicians, you're talking to the surgeon, you know the questions to ask. To say, hey, I read about this. Is this one of the complications? And be informed and make sure they're talking to you. So even after you have the diagnosis, you're in the hospital, make sure that you're talking to the doctors and make sure they're answering all your questions and that your voice is heard.
There you go, viewers. Advocate, advocate, advocate. And you have a resource here in the Black Scientists Cooperative. If you have additional questions regarding this episode, feel free to DM us, and we'll be sure to get you in touch with the resources that you need. As always, thank you for watching, and we will see you next time. Bye-bye.
All right.
Deep flows like a breeze flowing through me, from my head to my feet. Your love runs smooth, ooh, it soothes, and you're making life right. I'm so glad that you're mine, you're mine.